Hello everyone, this is Dr. Sushma Sarilla, consulting homeopath at Fidicus Homeopathy. Today we are going to discuss about a topic called as Tinea. It is also called as ringworm. So why are we discussing about Tinea or ringworm today is that because the rise of cases in summer, that is Tinea cases or these ringworm cases usually rise in summer season, and also their contagious nature because they spread from one person to another person either through direct skin to skin contact or by using their materials like clothes or towels or even combs, and also the disruption it causes in the work life balance because of the itching that is associated with it. So let us dive into the topic to know more about tinea, its types and its manifestations. What is tinea? So tinea or ringworm is a contagious fungal infection which causes redness and ring-shaped structures. But here if you can see, the ring shape is distorted. Why is it distorted? If it spreads to a larger area of the body, then that ring shape is distorted and it is forming different types of shapes. But what is the characteristic of the ringworm is that there is central part will start healing as it spreads, and the peripheral part, which is the outer lining of that ringworm, is always red, as you can see here. It is flaky and very itchy. Now let us know the signs and symptoms of ringworm. The primary presentation of ringworm is red, scaly, itchy rash which looks like a ring. As you can see here, first when they present themselves in the smaller section of area, it is usually round in nature. And when they spread to a larger area or a larger body part, this ring shape is little distorted. But as you can see in the picture, there is a little bit of central healing starting here. That is, the central part of that ring is always starting to heal, and the peripheral part is more red, more distinct, more itchy. It has small blisters like presentation, and also from here it will spread and here it will start to heal. This is the characteristic feature of ringworm. What are the other signs and symptoms of this ringworm? As you can see in the picture, it can spread anywhere in the body. It can spread to scalp, it can spread to the nails, it can spread to the whole body, even the foot also. So depending upon the spread or where it is presenting, there are different types of tinea. Here as you can see, it is a tinea which is presenting on the foot. And if you can see in the picture, there is small blister like presentation and also pus associated with it. So tinea, what are the major signs and symptoms? It is ring-like structure usually in the starting stages, and if it is spreading to the larger part, then it is distorted, but the central part is healed and the peripheral part is always spreading. It is very itchy, it is red in nature, and sometimes it can cause pigmentation also in the areas that it is spreading. And also there is little bit of because of scratching, there is little bit of bleeding also, and there is scaling also. These are all the major signs and symptoms of tinea. And in certain cases you can see pustula, that is pus being associated with the blisters on the tinea rash. Now let's get into the investigations part of ringworm or tinea. Usually through physical examination, by viewing and also by examining the whole body of the person, we will be able to finalize what kind of tinea it is. But in certain cases, we need certain investigations. That is primary thing, skin scraping. So what is skin scraping? As you can see in the picture, the doctor will scrape off the outer part of this infection, and then they are viewed under the microscope to see if it is tinea or not. What are the other investigations needed? If in case they are not able to diagnose, a hair sample can be taken if it is affecting the scalp, a nail sample can be taken if it is affecting the nails, a skin sample can be taken and cultured if it is affecting the body area, and in certain cases, but very rarely, we need a skin biopsy. Now let's get into the structure and function of the skin. Everyone knows that the skin is made up of three major layers. One is the epidermis layer, the second is the dermis layer, and the third is the hypodermis or the subcutaneous layer. The epidermis layer is in turn again made up of 5 different layers. So any problem in the epidermis layer which protects us from the outer environment against the bacteria, this layer if it is disrupted, then we have certain kind of diseases associated with it. Now let's see what are the functions of these 3 layers. As you can see in the picture, this outer layer is called the epidermis layer, and this layer is the major protecting layer. Any form of breakage in this layer can cause the pathogens, that is the bacteria, the virus or the fungus, to get inside and multiply. So the epidermis layer is a protecting layer. It helps in thermoregulation also. And coming to the dermis layer, this dermis layer has the blood vessels. So whatever nutrition we take, it will from the dermis layer, it will reach to the epidermis layer. And the outermost part of the epidermis layer, the stratum corneum, is a dead layer. Whereas in the dermis layer, we have the thriving cells, that is the living cells. And down here, if you can see, this is fat deposition, which is nothing but the subcutaneous layer, which helps in insulation. Now let's get into the causes and the risk factors for tinea. First, we will discuss about the risk factors. So what risk factors lead into tinea breakout or the ringworm breakout? As you can see in the picture, any direct contact from a person who is already suffering from tinea or this ringworm infection can cause or can be contagious. That is, direct skin to skin contact or using their clothes or using their towels or using any of their personal belongings, sharing bed linings can also affect or be contagious to the other person. And not only that, staying in hot humid climate where you will be able to, where you are becoming very sweaty, this can also be a trigger factor or a risk factor for tinea. That is why, according to the statistics, the tinea cases are more prominent in the tropical areas where it is hot and humid. And then contact with an unhygienic pet. For example, if your dog or your cat is suffering from a fungal infection and you are in contact with it, there is every chance that it can be transmitted from your dog or from your cat to you as well. And from you, it can spread to your other family members also. Sharing personal products, even sharing a comb, can also infect the other person. And then acquired infection from swimming pool. For example, a person who is suffering from tinea, if he swims in the pool and the next time you get into that pool, there is chance that even you will be affected if it is not properly chlorinated or properly cleaned. Next, coming to the immunocompromised state. Remember that the body has inherited certain characteristics, like it has characteristics to fight against a particular pathogen. That is, either it can be bacteria, either it can be fungus, or either it can be virus. But if that immune state is compromised, why is it compromised? If you are taking any corticosteroids for certain diseases, if you are having autoimmune diseases and you are taking immunosuppressants, or you are unhealthy, you are not taking proper diet and you are not clean, that is unhygienic in nature, then that can also be a problem. And also having immunocompromised state due to certain diseases like HIV, all of these can be the risk factors for acquiring tinea. Now let's get into the now let's get into the causative factors or the main causes of this infection. These are called as dermophytes. So there are major three dermophytes which are affecting the skin causing the tinea. First one is called as trichophyton, epidermophyton or microspora. These are the main three dermatophytes which will cause this fungal infection to be occurring in humans or even the pets. As you can see in the picture, these are the spores of the fungus which will cause the tinea or the ringworm infection. When the person is suffering from ringworm infection, when the doctor scrapes and views under the microscope, you will be seeing the spores which are affecting the skin. Now let's get into the body changes. That is, what will happen when this ringworm infection, or what will happen in the body when this process of ringworm infection is going through. So let's check out in detail. As you can see in this flow chart, there is spoils either from the animal or from the man, that is from the other person, or from the soil. That is, if you are walking barefoot on certain places which are hot, which are humid, like even beach places, or where there are a lot of people there, that can lead to spores falling on the ground. For example, your pet is suffering from tinea and it will scratch and those spores will fall on the ground and you're walking barefoot there, then that can also be contagious. So spores from the soil, from the animal or from man, these are called dermatophytes. They can invade any part of the keratin layer in the epidermis. That is, it can affect your skin, it can affect your hair, it can also affect your nail and your nail bed as well. So if there are any problems in the keratin layers of the epidermis, that is any break in the epidermis layer, or your epidermis layer is very thin, or you're immunocompromised, where the skin abrasions occur, or you have very dry skin and you're scratching frequently. See, if you're scratching through the naked eye, you will not be able to see how devastating it is for the epidermis layer. So you will have minor cracks. So this, under the exposure of the contagion, can lead the dermatophyte directly into the stratum corneum part of the epidermis, and from there what it will do is it will release keratinase. So after release of keratinase, what the body will do is, because of release of inflammatory mediators, what is inflammatory mediators? These are some chemicals which will tell the body to fight against certain bacteria or a certain pathogen. Or that, what do you mean by pathogen? Either bacteria, virus or fungus. Okay. So whenever there is this inflammatory reaction, what will happen is the body will start to fight. If you have a low or a compromised immune state, that is because of HIV, it can be because of your corticosteroids or any other conditions, then this immune reaction is not proper, and also this immune reaction will cause this redness, swelling, heat, and also if it is in the hair, it will cause alopecia, that is falling of hair in a certain area where it is affected. And then because of the low immune state, it can cause the spread of this dermatophyte, that is it will spread from one state to the other state. And also hot humid climates are like the more breeding factor, where they will breed properly and they will expand, divide properly, and the spread is really vast and extent. And you can see the characteristic feature of ringworm, that is central part it is healed, the peripheral part there will be spreading. Now let's get into the types of tinea. Remember that based on the place or the area where the tinea or this ringworm is affected, it is called a different name. It is different in head if it is affecting the scalp area. It's called differently if it is affecting the nails, or it is called differently if it is affecting the body. So first let us know about tinea pedis. So by pedis we mean foot. It is also called as athlete's foot. So who are prone to this? People who wear socks for a longer period of time, who are sweaty or have sweaty foot, and they do not change their socks frequently. These people usually have this tinea pedis. So what happens is that usually in between the skin folds of these toes, the tinea will start. So whenever you're bathing, make sure that you put your soap or whatever body wash that you're using in between your toes also. If you are having a sweaty foot or smelly foot, make sure you clean them either in Epsom salt, or you put a little bit of salt in hot water and soak your feet so that your foot is clean. And also make sure if you have any skin abrasions or any cuts in your feet, do not walk on the floor without any footwear. So it usually affects the skin folds, and then it goes here. It is very itchy in nature. It is a red and it is inflamed. This is called as tinea pedis. This is called as tinea cruris. What is cruris? Cruris means the area which is connecting the trunk part and the leg part. That area is called as loins. So if the tinea is affecting the loins, that is the area connecting the trunk and the leg area, because it is folded, because there is every chance that you get sweaty because of the lot of clothes that you put and also the hot humid weather, many people suffer from this tinea cruris. Even if you see in the advertisements, they will show tinea cruris, that is jock itch, that is the area between the trunk and the leg area, okay, connecting part. So this tinea cruris affects the loin area. It is very itchy in nature, and if there is no stopping of this spread, it can even spread to the genital area as well. Next one is called as tinea capitis. So the problem with tinea capitis is that many a times that this wherever the ringworm is affected, and if it is spreading rapidly, the person is immunocompromised, you will see that you will have two types in it: inflammatory and non-inflammatory. In non-inflammatory, you will not see any sort of redness in that tinea area, but you will only see alopecia, that is falling off of hair in bunches in the area that the tinea is affected. It is usually seen in severe cases that the alopecia occurs. And also in inflammatory cases, what we see is that after the hair has fallen, you will see that there is this red color severely red, severely itchy, yellowish tinge on that area where the hair has fallen or alopecia has taken place. This is called as tinea capitis. By sharing combs or hair products or even anything that is related to the scalp, any product that is related or any instrument that they are using for their hair, if one person is suffering and you are using that, you will have every chance that you will be affected by this tinea capitis. So make sure that you clean your comb at least once in a week, washing or using soap. Next is your Tinea unguinum. What is unguinum? Unguinum means nails. As you can see, it occurs near the nail part, as you can see here. So even the nails become crooked, they become dark, they become thick, and sometimes they break off easily also. They become thick in one area and they become thin in one area, so they break off easily, and it is affecting even the nail bed also. It is very itchy in nature. If you're using nail cutters or anything to do with the nails, even if you're going to nail salon also, make sure that they are using sterile equipment. That is, once they use for one person, then they should be sterile or they should be free from bacterial contamination while that same product or that same material is used for another person. When you go to saloons, make sure that you're going to a proper saloon where there is cleanliness. And also, even your nail cutters, one person nail cutter should not be shared with the another one, because the nail, we will have lot of deposits in the nails which will not see properly. If you see microscopically, there are a lot of dead debris cells and also a lot of dirt inside the nails if you're not cleaning it properly. So make sure that your nail filing stuff or your nail cutting equipment should not be shared with other person. Next, the tinea corporis. It is most common form of tinea. Corporis means it can affect the body parts. So it affects the underfolds of the breast, it can affect the elbow area, it can affect the knees, or even it can affect the back of the person. So this tinea corporis, it can spread very rapidly. It is most common in people who are very unhygienic, who do not bath on a daily basis, and also who share their clothes or their bed linings with other people. So where is it more common? All of these three things are very common in hostels. So people who stay in hostels should be very careful, and also make sure that you're washing your clothes properly. And if you're suffering from tinea corporis or any form of tinea, make sure that you wash your clothes in hot water and then dry them out in direct sun. This will cause the spores to dehydrate and it will not affect the other person. So people who are sharing their bed linings or people who are staying in hostels are more prone for this tinea corporis, and also people who are unhygienic or who are immunocompromised. Now let's get into the conventional treatment part of tinea or this ringworm. As soon as you're diagnosed with tinea or ringworm, your dermatologist might suggest a cream, a topical cream for your ringworm. The problem with this topical creams is that if you're suffering from ringworm here, you're applying the topical cream here, and then it will fade away, and the mark will also fade away in few months. But there is every chance that it can reoccur if your skin or the internally where your immune system is not strong is not addressed. So that is the problem with the topical creams. Second thing with the topical creams is that if you're using them for a longer period of time, they tend to cause the skin more dry, and also it will be not effective if you're using it for a longer period of time. If it is not able to control, that is, if the topical creams are not able to control the spread of the tinea, people will describe or the doctor will describe your oral medications like fluconazole. The side effects of fluconazole is that certain kind of people or certain section of people who are sensitive will have nausea, they might have gastric pain and also vomitings associated with this tablets. So if you're looking for a proper cure, what should you do is that you should look for a treatment which will address the cause of the disease, which will decrease the spread of the disease, and also which will give you immunity. Coming to the homeopathic treatment part, the addressing issue like the cause is addressed, the spread is decreased, the infection is decreased or the irritation is decreased, and also there are no side effects. All of this come in a package in homeopathic treatment because it is safe to use, it's timely, it's holistic. That is, for example, if you're suffering from an autoimmune disease and you're using immunosuppressants, and you're putting on topical creams, what is the use? It will decrease the infection in one area, and it can spread to the other area, or it can spread to the other person as well. But in homeopathy, what we do is that we will increase the immune system, or it will activate the immune system by the medications, so immunity is increased. And also, not only that, we will give you medications where it is treating that present part. The recurrence rate in homeopathy for the ringworm infection is very, very low. That is, if you're suffering from ringworm infection and is completely cured, then there is very less chance that you will be again having ringworm infection in the future if you take proper precautions. And not only that, there is individualistic approach. For example, two persons in the same family are suffering from tinea. Okay, two persons may get two different medications because the mindset, the individualistic nature of two persons in a same family is different. So are the medicines in homeopathy. It is tailor made to fit for your needs. It is cure from inside out. It will help in preventing future recurrences. It will cure your present condition and also relieve you of all the symptoms. So if you're looking for a proper cure for your tinea, try choosing homeopathy. Coming to the precautions part, precautions are very, very important in tinea cases because it is very contagious in nature. So what are the precautions that you should follow? If you are right now suffering from tinea or this ringworm, first thing, wash yourself every day in the morning as well as in the evening. And also after working out, after you're very sweaty, make sure you do not stay in that sweaty state for more than 1 hour. That is, after workout, make sure you wash yourself immediately. And also wash the workout clothes in hot water and dry them under sun. If you're presently suffering from tinea, make sure you eat good amount of citrus fruits or fruits that contain high vitamin C content, like your citrus fruits like orange or lemon or even kiwi or guava, so that the immunity is building up properly. And wound healing, this vitamin C will help in wound healing. So it will, by taking high amount of vitamin C, your skin will be able to fight this infection. And also, do not share any of your belongings to other people. For people who are looking for precautions, even if you are not met with tinea or not had an infection of ringworm, make sure you bath twice daily and brush or use soap in between your hands, in between your toes. And also make sure that you do not use any sort of hair appliances that the other person is using. Have a personalized kit for your hair, for your nails, and also do not share any sort of your clothes or any other belongings with other persons. If you're staying in hostels, make sure that your clothes are properly dry before wearing them, and don't share any belongings with other girls or other boys. Coming to the neglect, that is prognosis part. So what happens if you neglect this tinea? See, if you neglect this tinea, because it is contagious in nature, if one person in the family is suffering, every person in the family, it can spread to other persons in the family as well. Second thing is that the spread internally, that is, if you are suffering from tinea in the hands, that is nail tinea, or if you are suffering from tinea corporis which has occurred on your hand, it can spread to the whole body. It can be very disfiguring, and also emotionally it can disrupt the work-life balance. The itchiness that is associated with it can increase. So make sure you get proper treatment if you are suffering from tinea. Coming to the consultation part, if you're suffering from tinea and you're looking for cure and you want to contact us, here at Fidicus Homeopathy, we are offering you with two different types of consultations. One is online consultation, the other one is offline consultation. If you're staying nearby the nearest branch of Fidicus, you can come and visit us in person and take doctor consultation. But if you are staying far away from us, you can connect us either through audio online call or through video online call. There are two facilities in online consultations. After doctor consultation, if you are having any sort of investigations, you can share it with us, and if you need further investigations, we will let you know. After this process, the medicines will be delivered directly to your doorstep. If you're staying in India, 3 to 4 business days. If you're staying in USA, 3 to 5 business days. And if you're staying anywhere else, it can take 4 to 8 business days for our medicines to reach your doorstep. If you're seeing this channel and if you're suffering from tinea or any other skin diseases and you would like to get in touch with us, you can call us through on this number, you can message us, or you can WhatsApp us on this number. And if you would like to know more about Fidicus Homeopathy, you can check our website www.fidicus.com. If you're suffering from tinea or if you're suffering from any other skin diseases and you're looking for a proper cure, why should you opt for Fidicus Homeopathy? Because here at Fidicus, it stands for highest chance of health. Here we follow three things. One is already the highest success rate we are seeing in the skin diseases sector, that is Fidicus Skin, and also in this ringworm cases. The treatment we give here is transparent, that is, we discuss with the patient what is the prognosis of the case, what is the status of the case, and also the personal care we give here at Fidicus is top notch. Any sort of queries that you have, myths that you have, we will educate you on that. If you're looking for proper cure, choose Fidicus Homeopathy. Thank you.